My Lyme patient had an electrical shock sensation. This is part of a common sense Lyme disease series. Let's begin. She felt like there was something zapping, like a cattle prod. She was in her early 40s. There was a sudden sharp jolts down her spine. Her body was jumping, but it wasn't spasm, it was just nerve jolts. What she's describing is something that's often seen in Lyme disease, where you feel like lightning bolts. They strike down the spine into the limbs. It can last 1 to 2 seconds. They can be intense. They can occur fairly common and can last longer. They can also occur when they're walking, resting, or sleeping. What happens is that it could be radiculopathy, which is inflammation at the nerve roots, where it's shooting down the nerves, or there's something called central sensitization, which is a hypersensitive nervous system. The signals aren't imaginary, they're misfired response. It feels like it's imaginary, but it's commonly described in the literature, and I see it in my practice. In her experience, she had an extensive workup because the discomfort was so profound. No spinal injury, no MRI findings, normal labs. But in addition to that burning pain, she had fatigue, brain fog, joint pain. Now, Lyme disease became part of her evaluation after exhausting other approaches. Lyme disease was diagnosed with treatment, though. The symptoms faded and then gradually stopped. So these kind of cases I see in my practice. They're commonly described in the literature. The last 40 years, radiculopathy and central sensitization has been emerging as a common Lyme disease problem, but it's part of this Common Sense Lyme series. Subscribe to this series if you haven't already done so. Comment if you have a symptom you've been struggling with, and follow along as we dive into 90 types of Lyme disease pain, one video at a time.